Hi, today we will study about the clavicle fractures. We will try to understand what a clavicle fracture is, and we will come to see how the clinical manifestations are there, what are the investigations we do, and how to manage a clavicle fracture. Coming to the anatomy of clavicle fracture, the clavicle is the most commonest fracture, especially in children, and it is the horizontal bone in the body. It keeps the shoulders apart and helps in formation of shoulder girdle. It also protects the neurovascular structures below it and helps in attachment of the muscles medially sternocleidomastoid and in between pectoralis and laterally the deltoid and the trapezius. It also helps in protecting the thoracic organ by formation of thoracic cage. So coming to the ossification, the clavicle is the first bone to begin ossification in fetus and only long bone in the body lying horizontally. Most common bone to fracture in children, and its location and structures: medially it is attached to the sternum, laterally it is attached to the acromioclavicular joint. As I have told, it supports the shoulder and helps in protection of neurovascular structures. The displacing force when the fracture occurs in the middle third, which is the commonest fracture, the sternocleidomastoid, which is attached on the superior aspect medially, will be pulling it upwards, and on the lateral side, the trapezius and the deltoid muscles will also make the angulation superiorly. So whenever the fracture occurs, it angulates like that. Coming to the classification of clavicle is named by Ullman. So type 1 is the middle third, type 2 is the lateral third, and the type 3 is the medial third. Medial third fractures is usually associated with complications. Coming to the clinical features, the patient presents to you with history of fall on an outstretched hand or a direct impact. When you are examining, there might be tenderness, swelling, and bruising in and around the collarbone, and the patient might present to you with neurovascular deficits or sometimes breathlessness if the pleura is being injured. So coming to the investigation, you will do an AP X-ray of the clavicle to see if it is fractured. Sometimes it might be associated with thoracic injuries and other bone injuries, and sometimes if you are suspecting an injury to the thorax or a pathological fracture, you might ask a CT scan or an MRI. When the patient presents to you, you have to stabilize the patient and send for an X-ray. Usually in children, it will be treated with an arm pouch, but in adults, a figure of 8 sling along with the sling can be given, and it has to be tightened on repeated examination to maintain the continuity or the fracture reduction. If there is a fractured clavicle with an increased gap or tenting over the skin, or if it is associated with pathological fracture like a cyst or a metastasis, it might has to be fixed. A fixation of clavicle can be done by open reduction internal fixation with a recon plate or a clavicular plate, or it can be fixed through a intramedullary tense nail from lateral to medial side. Usually, the clavicle fracture is associated with complications like neurovascular deficit, or if it is injuring the lung, there might be pneumothorax. Thank you.